Hello everybody, my name is Ahmed Mirza. I'm a family nurse practitioner. I also work in the emergency room and in the urgent care. And in my last video, I did speak about what it takes to become an emergency nurse practitioner. But today, let's talk about salary of an emergency nurse practitioner. Let's go. So a typical shift for emergency nurse practitioner can vary. In many large hospitals, nurse practitioners do rotating shifts. There'll be a day shift, an afternoon shift, and a night shift. But in many small hospitals, sometimes there's not an overnight nurse practitioner. It could just be one or two physicians staffing the night shift in the ER. And there are some nurse practitioners that work exclusively days or exclusively nights. But for the most part, you'll do a rotating shift. So with working the night shift, you'll have a shift differential. Usually this is if you work past midnight, and all groups will have different kind of pay scales, but you can most likely expect if you're working past midnight, then you'll get a shift differential. Now this can vary. There are some groups where they'll pay you a certain amount if you work past midnight, and they'll pay you even more if you work overnight after midnight. So for example, if you're working till midnight, you can maybe expect to get anywhere from $5 to $10 an hour. But sometimes if you're working overnight completely, like until 3 a.m., 5 a.m., 6 a.m., you can make anywhere from $10 to $15 extra per hour. But a typical shift differential that you can expect is $5 to $10 an hour if you're working past midnight. Productivity is another way that you can generate revenue as an emergency nurse practitioner. Productivity is usually based on patient volume and RVU. RVU stands for Relative Value Unit, and it's the way Medicare figures out how much they will reimburse for the work that you do. So you can accrue good RVU by seeing high volume of patients, seeing high acuity of patients, and doing procedures. For example, if there was a dislocated shoulder and you did a reduction, that's considered high RVU compared to just seeing an easy patient with upper respiratory symptoms, or doing a laceration or other procedures. If you do get productivity based on RVU, usually your group will look at a month to month, see how much RVU you had, figure out some kind of calculation, and then they'll keep some of the RVU reimbursement, obviously, and then give you a percentage of the reimbursement. And this is usually on top of your hourly rate. So for example, say you're getting paid $55 an hour, base rate no matter what, then you also add your RVU. Most of the time, they'll wait until the end of the month, or sometimes there's a 2 to 3 month delay of getting your RVU reimbursement. Other places may pay you a set dollar amount for every patient that you see in addition to your base salary. So this could range from anywhere from $3 to $8 an hour. So if you're working at 10-hour shifts and you saw about 20 patients, 20 times 5, that's an extra $100 you'll make that shift based on your productivity, in addition to your base pay. Most groups, if you're working full-time, you'll also get a Cme allowance. So some groups do this and some don't. I've worked for some groups that just had a high hourly pay and had no Cme allowance. Other groups that do provide a Cme allowance. This can be anywhere from 0 to the highest I've seen is $2,500. Now every group will have different rules on what you can do with this money. Some groups, like the group that I work for now, that $2,500, you can spend it for anything that is related to your work. So if you need new scrubs, you need a new stethoscope, you need shoes, you can use that allowance money. Or if for CME, so if you need to go to a conference for continuing medical education, lodging, hotel, that can all be covered. Now there are some groups that strictly only allow this money for education, so you'll just have to figure out what your group does. And then 401k match. Most groups, if you're working full-time, you'll get a match anywhere from 3 to 5%. Some groups don't offer a match at all, so it's definitely something to look into. Relocation bonus. Now this is not always offered. Sometimes you do have to negotiate this. With such a competitive market, sometimes it's hard to get a relocation bonus, but a lot of times you can negotiate that. I was able to negotiate for my current job, and you can probably expect a typical $5,000 relocation, but usually this comes with a 1-year commitment. And if you do end up leaving before the 1 year, then most likely you have to pay back that $5,000 total. All right, now the hourly salary. So this, of course, will vary based on location and the experience that you have. Typical salary range in the emergency department is on the low side, $50 to the highest I've seen is $85 an hour. So $50 to $85 an hour. In most major metropolitan cities, you'll probably expect anywhere from 50 to 65 as the base salary. Now, there may be other bonuses that you can get for productivity, but that is usually the base. And this is, I think, most true for a lot of the Midwest areas. I've seen 50 to 65 on average. And then in the more southern states and California as well, you can expect anywhere from $70 to $85 an hour. For example, in Houston, some of the groups were paying just $85 flat, no bonuses, no CME, no PTO, just $85 an hour. You work, you get paid. You don't work, you don't get paid. Other groups, in Austin had a base rate of about $55 an hour plus RVU productivity. That will get you anywhere from 70 to 85 overall average an hour. I've seen places in California that were just paying a straight $85, even $87 an hour salary. Some groups will have a raise schedule. Say you start at $65 an hour. Within 1 year, you get a $3 raise. Within 5 years, that could be up to a $10 raise. Some groups won't have any raises at all. Like I mentioned, some of the groups that had the higher pay, $85 an hour, usually that $85 an hour is kind of set in stone and doesn't change. Even if you're working there for 5 to 10 years, you'll be at the same pay rate. So kind of pros and cons to that. If you're a new person, only 1 to 2 years of experience coming into the group, you'll right away start off at that high pay. But if you're someone that's been there for 10, 15 years, you're kind of stuck in that pay and may feel stagnant in your pay scale. Most ER groups require 120 hours a month for full-time pay and benefits. So that equates to less than 30 hours, and that's considered full-time for your full benefits. You can always pick up extra hours, or you can work contingent somewhere else. And with contingent jobs, they're usually with no benefits, and the pay rate is usually higher than if you were working a full-time job. Other bonuses that you may get are partnership bonuses. Some groups offer based on seniority, how many years you've worked in the company, and some may have profit sharing with the bonuses. Some also, like I said, based on productivity or other incentives like being a lead APP or attending meetings or being part of committees. Yeah, there are many different kind of bonuses out there, and it all kind of depends on your group. So make sure you review your contract really well, get an attorney if you need to, and that's about it. I hope you kind of got an insight of what the pay like of working in the emergency department as a nurse practitioner. I would say, kind of to summarize, you can expect anywhere from 50 on the low side, especially if you're new, to on the high side, $85, $87 an hour. The median, I would say, is probably $60 an hour as a emergency nurse practitioner, kind of across the boards. Well, I hope you enjoyed this video. Hope I kind of gave you some insight of what the pay is like as an emergency nurse practitioner. Please give it a big thumbs up and subscribe for more content in the future. Thank you. Bye.